Thanks for joining us here on WCI TV, brought to you by Tower MSA Partners. I'm your host, Bob Fryer, and right now we are joined by Jan Saunders. He is the Prosthetics and Orthotics Director at HomeCare Connect. Sir, good to see you.
Good to meet you.
Nice to have you here. How soon should an injured worker be sent to you? Not right at the time of injury, or is there some lag time?
Well, actually, we have a lot of carriers who will send patients to us actually when the opportunity presents itself before the amputation takes place. The whole secret to the rehabilitation and also managing the cost drivers is early intervention. So very often, because I'm a prosthetist, I can talk to an injured worker who's just gone through an amputation, and I can help to reduce their anxiety. I can let them know, because I have the answers of how they're going to get through this, and that basically all they need to do is heal up and do well, and that we're going to carry them through this whole process, myself and my team.
You know, prosthetics is one thing, limbs is one thing. You can actually do socket replacements as well?
Yes. What happens, it's normal in prosthetics that a patient's residual limb goes through physiological changes. Just like if you've ever seen a friend who's broken their arm and they get put into a cast for 6 or 8 weeks, and their arm comes out and now it's all atrophied. The same thing happens to a residual limb on an amputee. So the care for socket replacements, for replacement of the prosthesis, is an ongoing process for the rest of their life.
What are we looking at in terms of like cost projection standpoint?
Well, I do cost projections for the carriers on a regular basis. They need to set their reserves early. And so we have algorithms and things that we've developed that I can take a patient's age, what the level of their amputation is, once they're evaluated, and I know what kind of components they're going to do. And I can go ahead and project out to age 78, 80 years old what the carrier is going to have to put into reserves. And very often, because in workers' comp, most of your injured workers are fairly young, that those costs will go into the millions of dollars, and the carrier puts those money away so that they have the reserves all set early on.
Jan Saunders, we appreciate you spending a few moments here with us.
Thank you.
Please enjoy the rest of the conference.
Thank you.
And you can look for a lot more interviews right here on WCI TV, brought to you by Tower MSA Partners. Again, I'm your host, Bob Fryer. We'll see you soon.